Welcome to Operational Planning with Insurance, Improving Employee Productivity. This is video number 9. In working with businesses over the years, I have found that most businesses, regardless of industry, size, or geographical location, they all struggle to maximize productivity. With the average employee absenteeism rate in 2011 of 9.3 days, and at least 3 times that rate in lost work from presenteeism, decision makers really lack hard data to lower these rates. Now, absenteeism, of course, people aren't at work. They're not working, and therefore, if they're not working, they're not producing, typically. In presenteeism, that refers to the idea that, you know what, they're there, but they're not all there. They're not working as well as they could be. So it's funny to know that those rates are light years away from one another, but nobody really has ideas of how they actually can reduce some of those rates. And it's costing businesses thousands and thousands of dollars each year. So some common solutions. Decision makers really, they just try to rely on historical information to piece together productivity strategies. Or we'll just pay people more. We'll increase their group benefits. We'll do all kinds of stuff just to keep people happy and working. But there's a lot of other things that you can do to help increase your productivity. Let's look at a few. So what if real data was available identifying areas of low employee productivity as a result of health risks, safety risks, and communication breakdowns? What solutions could be put in place that lowered health risks and then therefore increased productivity, lowered safety risks and increased productivity, and lowered communication breakdowns and increased productivity? Let's take a look at some problems. Now, suppose after analyzing data, you found the following information. You found that 12% of your staff were smokers. And you also realized that 1% actually had their smoke within the first 5 minutes of waking up. And you found also that 5% smoked between 5 and 30 minutes of waking up, 3% smoked between 30 and 60 minutes of waking up, and 3% didn't smoke until after 60 minutes of waking up. Again, should you be concerned? Well, data does say that if you have a smoke within the first 5 minutes, you've really increased the likelihood of developing lung cancer by 3.5 times. You've also increased, if you have it between 5 and 30 minutes, it increased your chances of having lung cancer by a factor of 1.7 and also 1.5 if you smoke a little bit later. So again, the solutions that you come up with to help your staff understand this and reduce smoking, or even reduce the time that they have before they take their first cigarette, will really change lives. Let's look at some more. Now, what solutions could you come up with if you found, after looking at some research and your own data inside your business, you found employees that were living with physical ailments and they never received medical help? No treatment. They sat there and just endured the pain. In fact, you had 38% receive no medical treatment for at least 3 ailments. How does that affect their productivity? 46% actually received no medical help for at least 2 ailments. Further research in your data, you found that actually 56% currently received medical help for at least 1 ailment. So they're constantly in pain. What solutions could you come up with to help them alleviate some of this pain so they can be more productive? By increasing productivity by 10%, that can add up to 20 minutes per day or 3.5 days per year in more creative and effective output per person. How would that affect the business's bottom line? How would that affect the morale inside your business? Let's look at some more. Here's a potential safety risk. Suppose, after doing some research, you found that 31% of your employees actually reported having trouble sleeping at least 3 to 8 weeks over the past 12 months. How do you suppose that would affect their productivity? It certainly would affect their judgment, their mood, their ability to learn, retain information, and maybe even increase the risk of accidents and injury. Obesity, diabetes, cardiovascular disease, or worse. Now, with respect to communication breakdown, suppose, after doing some research, you found that 8% of your employees reported having periods of time lasting for several days or longer where they were irritable or grouchy, and they started arguments, and they were shouting at or even hitting people. How would that affect productivity? People would walk around, they'd have hurt feelings, there would be disruptive interactions, there would be loss of innovations, unproductive work certainly, increased turnover, loss of morale, dangerous environments, or worse. Suppose that you found that your employees were using paramedical services. That's great. That's why you have group insurance programs. Further research, you found 20% actually made at least 8 visits to see a massage therapist or a chiropractor. You also found out that 8% made at least 1 visit to see either a psychiatrist, a psychologist, or some other mental health professional. What could you do to actually improve productivity if you knew this information? Potentially a half a day of work is missed just seeking those treatments, causing delays, missed deadlines, and increased team pressure to overcome their absences. So what solutions could alleviate those things? Here's a potential safety risk. Suppose you found that 4% of your employees reported having at least 4 accidents, injuries, or poisonings over the past 12 months. How would that affect their productivity? Would they have to receive medical treatment? Well, they receive medical treatment, therefore their disability claims could potentially go up, and when the disability claims go up, the increased rates go up as a result of overusing your disability. There's prolonged waiting times to see the doctor because the doctors they're booked solid, and therefore the disabilities will last even longer because it's prolonged the time that they were able to get some treatment. They've even increased the unscheduled off work time. They're not there, so therefore they're not producing, and it's causing delays. With respect to communication breakdowns, suppose 41% of your employees indicated that they only scored themselves a 5 or lower with respect to their job performance. 10 being they were rock stars, 0 meaning that they were not very good at all. So now what happens? What does that do to their productivity? Well, certainly they want to be successful. So because they don't feel like they're being successful, they're leaving. They're finding other jobs to go to. They're talking to their other customers because the business isn't very good, and therefore you have less customer loyalty and there's weak financial performances. All because they actually don't feel like they're doing their best at their job. What solutions would you come up with if you knew that 2% of your staff that missed more than 4 days of work, it actually was due to health? In fact, 3% missed more than 3 days, and they were partial days due to health. What solutions could you come up with to help that? Alleviate that and make them more productive. 54% of companies fail to actually even track the absences or the root causes of those absences. And really, it doesn't allow HR departments to have the real hard data to help maximize their expertise to actually help these employees along, make the company more profitable. And more communication breakdowns. Suppose 52% of employees agreed or strongly agreed with their overall satisfaction with their employee benefit programs. Well, 48% means that they're unhappy or they are really ambivalent as to their benefit program. Your benefit program is only a benefit if people understand and use the program. Here's some solutions to improve employee productivity. Number 1, a health risk. If 61% of stressed employees indicated money as the source, bring in a money expert to help provide some help. Number 2, safety risk. If 50%, depending on which industry you're in, of workplace accidents actually occur within the age group of 15 to 24, especially during the first 6 months. Maybe you have them job shadow somebody that's there. Number 3, communication breakdowns. If employees indicate problems with attention or concentration, bring in a coach to improve the system. Number 4, health risks. If the average employee is overweight, through the body mass index rating, consider offering exercise or nutrition incentives to help them become less overweight and more productive. Safety issue. If employees report not working carefully enough, especially in November for some reason, then review the systems and then figure out why November. Communication breakdowns. If employees indicate that they have no work successes or achievements over the past 4 weeks, find ways to praise them and keep them happy. When trying to help your business, it's important to get real data. Improve employee productivity by implementing programs that actually helps and supports your staff by addressing real issues. Of course, to do all the things that we do, it requires a tremendous support team. And Maureen and Fred and David, they are key people in our organizations that help us do all the things that we need to do.